You might not have back pain, you might not even have knee pain, but foot pain is something that almost all of us have dealt with at some point. After a long day of standing, walking, or even wearing uncomfortable footwear, that dull ache in your feet still feels unbearable. And for most of it, it disappears with a little rest. But when foot pain persists for days or keeps coming back, it becomes a real headache. And trust me, ignoring it is not the answer. In this video, we are going to explore why foot pain happens. Circulation obviously plays a big role, and most importantly, what you can actually do at home to relieve it. Stay tuned because I'll share one very powerful rolling technique that has helped countless people feel instant relief. In India, millions of people suffer from foot pain every day, whether long hours of standing, walking barefoot on hard surfaces, or wearing the wrong footwear. And according to studies, nearly 20 to 30% of Indian adults report chronic heel or arch pain at some point in their lives. And the problem is only getting worse with increasing cases of diabetes, obesity, and sedentary lifestyles. The feet carry the entire weight of the body, yet they are often the most neglected part. Think about it. When was the last time you stretched your feet or gave them a massage? We pamper our face, our hair, even our back, but our feet only get attention when they start hurting. Foot pain can come from multiple causes: plantar fasciitis, heel spurs, flat feet, poor circulation, nerve issues, or even something as simple as wearing the wrong chappals, sandals, or shoes. And while medication, physiotherapy, or even surgery may be needed in severe cases, for many patients or people, relief can start with something incredibly simple: rolling. So, how does rolling actually help? Rolling works on the principle of what is called as myofascial release. The plantar fascia, which is a thick band of tissue that runs across the bottom of your foot, it connects the heel to the toes. When it becomes tight or inflamed, you will feel sharp stabbing pain, especially near the heel or arch. And rolling this fascia will help to improve the circulation, release the tension, and reduce the inflammation. It's like giving your feet a mini physiotherapy session without leaving your home. Whether you roll your feet over a ball or a bottle, you stimulate the pressure points that help relax not the foot but the entire leg. In fact, studies have shown that just 10 minutes of foot rolling daily can significantly reduce your heel pain and improve walking comfort. The beauty of this method is that it's non-invasive, inexpensive, and can be done anytime, even while watching TV, sitting on your desk, or before going to bed. And this is something that you can do even when you wake up. So the first step you take, your feet will not be so painful as you might be feeling. Here's the fun part. You don't need fancy equipment. Some of the simplest things you can use are already lying around in your home. A tennis ball like this, or even a hard ball, works perfectly well. A frozen water bottle is another excellent option, especially if you have swelling or inflammation. Rolling with a frozen bottle adds the benefit of cold therapy, which helps reduce the pain and swelling. For those who want a bit of comfort, there are these kind of spiky massage balls available online, but honestly, any one of these should do fine. Now let's get into the how to do it. Sit comfortably in a chair with your feet flat on the ground. Place the ball or bottle under your foot and start rolling from your heel slowly towards your toes, applying gentle pressure. You may roll front to back and then side to side, focusing on the arch of your foot where the fascia is most tight. Do this for about 2 to 3 minutes on each foot. If you find a particularly sore spot, pause and hold the pressure there for a few seconds before rolling again. Repeat this routine twice daily, once in the morning before starting your day and once before bedtime. Rolling is especially effective for people with plantar fasciitis, which is one of the leading causes of heel pain in India. But it is also helpful for those who have diabetic foot pain, people with poor circulation, or someone who spends hours standing or walking in one position. Teachers, shopkeepers, factory workers, nurses, and even homemakers, rolling can be a lifesaver. After long days on your feet, rolling not only relieves pain but also prevents stiffness and keeps your feet flexible. For those who wear high heels or tight shoes, rolling can undo some of the pressure and damage caused by these restrictive footwear. While rolling can give quick and lasting relief, it's important to remember that it is not a cure all. Your overall lifestyle plays a big role in foot health. Wearing supportive footwear is one of the most important steps. You should avoid thin soled chappals or shoes with no arch support, as they can worsen the pressure on your fascia. Also, maintaining a healthy weight reduces the stress on your feet. Simple stretching exercises for your calves and ankles can improve mobility and prevent stiffness. And here's something else which is often overlooked in India: hydration or water intake. Most people don't realize that dehydration can actually worsen cramps and stiffness in the feet. So make sure you're drinking adequate water and maintaining electrolyte balance. This helps to keep your muscles and fascia stay soft and supple. And for those with diabetes or vascular problems, proper blood sugar control and regular checkups with a doctor are crucial to avoid complications. There are several myths about foot pain that need to be cleared up. One common belief is that foot pain is just part of aging and nothing can be done about it. This is simply not true. While foot tissues do weaken with age, regular care like rolling and stretching can help keep them strong and flexible. Another myth is that you should rest completely if your feet hurt. While rest does help, complete inactivity can actually make the pain worse because it reduces circulation. So gentle rolling, stretching and movement will keep your feet healthier. Some people think that home remedies do not work and only going for specialized footwear is the first line of treatment. But remember that no matter how costly a footwear or an insole you buy, when you take care of your foot, your pain will have a much long-lasting relief. So the next time that you feel that you have throbbing pain in your feet, don't just ignore it, and there's no need to rush for painkillers or straight away to doctors. In this video, I have highlighted few important causes of foot pain and 6 very helpful exercises that you can do to relieve your foot and heel pain.